Senate Concurrent Resolution 20 requesting Bureau for Medical Services review and update Medicaid rates for ground and air ambulance services.
The senator from Preston County.
Thank you, Mr. President. I'd ask unanimous consent that the committee references that the resolution be taken up for immediate consideration, the committee references dispensed with, and the resolution be put upon its adoption.
Senator from Preston County requests unanimous consent that the resolution be taken up for immediate consideration, the committee reference be dispensed with, and the resolution be placed upon its adoption. Is there objection? Chair hears none. Clerk will read the resolution.
Senate Concurrent Resolution 20 requesting Bureau for Medical Services review and update Medicaid rates for ground and air ambulance services.
Question before the Senate is adoption of the resolution. Is there discussion? The senator from Preston County.
Thank you, Mr. President. I really didn't time the resolution to come up on this day, but it just kind of worked out that way. As we heard from the junior senator from the 17th early, today is EMS Day, and it's a very important day for many people across the state when it comes to first responders and health response. Unlike the police and fire departments, the ambulance squads in West Virginia receive little to no funding from the state, the county, or local governments to support their services. And most squads are entirely dependent upon the reimbursement from payers such as Medicaid, Medicare, and private health insurance to maintain emergency medical coverage in West Virginia. Even the few county ambulance squads that are fortunate enough to receive an ambulance levy funds are dependent on this reimbursement rate for the majority of their operating revenue. And I'll skip down. There's a lot of talking points here. But if you live in some of the larger municipalities, if you live in Morgantown, if you live in Wheeling or Parkersburg or Charleston or Lewisburg, maybe Beckley, you probably don't think too much about the EMS. You probably don't think too much about the ambulance service. You pick up the phone and a few minutes later they're at your house. But living in Preston County and across the district that the senator from Tucker and I share, very, very rural. About 3 years ago, I think maybe 4 years ago, Valley Ambulance Service closed their doors. They said, we can't make it anymore. Last month, Mountaineer Ambulance Service went out of service. They haven't quite gone belly up yet, but they're out of service. So that's 2 rural ambulance services in our communities that that we're serving our population. They're not there anymore. They're completely gone. So simply, this resolution sends a letter to the Bureau for Medical Services and asks them to please consider raising those reimbursement rates. The last time there was a reimbursement rate for mileage was 17 years ago, over 17 years ago. I think it was in 2000, November 1st, 2000. Since that time, 71 ambulance services in the state of West Virginia have gone out of business. They've closed the doors. Mr. President, I urge adoption of this resolution.
Further discussion? If not, the question before the Senate is adoption of the resolution. All those in favor will say aye. Aye. Those opposed, no. The ayes appear to have it. The ayes do have it. I declare the resolution adopted. Clerk will communicate the action of the Senate to the House.